Good evening, everyone, and thank you for joining me for our webinar, Healthy Aging with BEMER Therapy. And BEMER Therapy is about changing your life, changing your thinking. And I want to start out with a video here that hopefully will get you in the right mindset for this. So I'm going to play this video in just a few minutes, and then we'll get right into the heart of the matter here. Okay, so let's get going. BEMER, changing your life, really about changing the way we think about health and healing, and to look back at some of the science that this is related to. I think of BEMER as true life insurance. Typically, we get life insurance for people after we pass or are left behind for loved ones. But BEMER is about life insurance for you as you go through life. And it's truly a bright technology. The ingenuity and science behind this is impeccable, and we're going to look at some of this. Now, when I was first introduced to the BEMER, I wanted to do my own due diligence, and I had never seen a BEMER. I had never utilized one. I just went to read some information, and I saw a number of videos that had been put out. These were put out, most of them by the Microvascular Institute in Berlin. And this one in particular I want to show you because this is what I first saw, and I was wondering how they actually got this video. And this was done with some specialized cameras at the Microvascular Institute on live patients who were utilizing BEMER therapy. And this, a picture's worth 1,000 words, and no more is that evident than right here. And I want to show you this short video that really depicts what the BEMER's about, and really led me into this is what I want for myself and to bring to our patients. Now they talk a lot about vasomotion here, which is just the vascular motion, the walls of the vessel that help to move blood along and really assist the heart. And you're seeing a picture here of vessels that are about the size of your hair or smaller. And this is a middle-aged gentleman prior to getting on the BEMER mat. And this is just after beginning the BEMER therapy and maybe a couple minutes into. And we'll see a little more increase in blood flow due to what is called vasomotion. And you'll start to see along, especially on the right side, these clear vesicles start to line up along the edge of the vessel. These are white blood cells, and there's a significant boost in the immune system with the use of BEMER therapy. And this may be in the middle of an 8-minute treatment, and we see continued increase in flow. And we'll see later that this increase in flow is not just a pretty picture, but it leads to an increase in oxygen supply to the tissues, increase in energy production, increased removal of waste products, and a boost to the immune system. So this is after 8 minutes. So quite a significant difference. And I watched this video many, many times, and it really moved me to the extent I bought a BEMER without ever seeing one or using one. So now we'll just see a quick comparison before and after a single 8-minute treatment on the BEMER. So for me, that was quite profound. Now, when I say we need to change our thinking, I like to look a little at some medical history. And the statement here, good judgment comes from experience, but experience comes from poor judgment. I always remember this statement. It was when we do grand rounds in my surgery training, this quotation was there, and I always remember it. And we were always told you need good judgment. And it struck me, to have good judgment, there was probably a point in time we had poor judgment. And when we look at medical history, we see that. And the story of this gentleman in 1850, Ignaz Semmelweis, really points this out. And he was a Hungarian physician working in Austria, and he was relegated to the OB ward. He wasn't deemed worthy enough to be with the surgeons. And during this time in our medical history, it was not uncommon for young women to die during childbirth. And so he went to the OB ward and he observed what went on. And he saw that the doctors were going to the morgue to work on cadavers, to learn some of the anatomy. And they would immediately come back to the OB wards and deliver babies. And he thought to himself, something's being transferred from these cadavers in the morgue to these women. And they didn't know yet about microorganisms. That did not come till later with people like Pasteur and Joseph Lister. But he felt something was being transferred. And he said these 3 words. He said, wash your hands. And no one would listen to him. He was ostracized and ridiculed. And eventually he ended up as a young man in his early 40s in an insane asylum and died. Now, history was written, said if they had listened to these 3 words of Semmelweis, tens of thousands of young women would have been saved. But because of the refusal to think what these surgeons could be doing wrong, that they could actually be contributing to the demise of these women, they failed to believe that. And so they were causing a lot of harm and not listening to the words of Hippocrates. Now, it wasn't that they were willfully causing harm, but when someone came along and observed something, they were had a great refusal to listen and to change their way of practice. And when I look at some BEMER technology, particularly with electromagnetic frequencies, I feel we're in the same boat. There's this slowly coming around, but a great refusal to listen to what's going on. And so we see from Mahatma Gandhi, they first ignore you and ridicule you, and that certainly was where Semmelweis, unfortunately, lived. Then they fight you and then you win. And I feel with a lot of these therapies that are really safe, very effective, we're sort of in this fight now. And I think eventually we will win. Now, let's look at some brilliant men in our history. One, Thomas Edison. He was born before the Civil War, 1847. He died, I believe it was 1931. And he said, the doctor of the future will give no medicine. Now, you almost have to read that many, many times to grasp this. You think, the doctor of the future will give no medicine. This was approximately 100 years ago. But will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Certainly, BEMER fits right in here. But if you think, he said this about 100 years ago, and where we are right now, it's all about giving medicine. Again, we could look at William Osler. He was a very famous Canadian physician, and he lived in late 1800s, early 1900s. And here's a statement he had in 1891. He said, one of the first duties of the physician is to educate the masses not to take medicine. Again, that's another sentence you have to read several times and see how does that fit in today, and it really doesn't. But this is over 100 years ago, and we need to educate the masses not to take medicine. I have a rule for myself that I've learned over the years. If I see an elderly individual, they come in and they tell me they're taking no medicine at all. Now, that's unusual. But a light goes off in my head and I say, just leave them alone. Don't do too much. They're going to be okay. Whereas when I see individuals taking 3 or more medications, and that is very common, I tell them you need to be Buddha, Job, and Gandhi rolled into one to correct some of these cellular deficiencies that these medicines do. Now, that's not to say every medicine's bad. They're usually designed for short-term use, and we should not be on these multiple medicines for a long time. Yet, where are we? Well, we spend more on medicines than do people of all these countries combined. And I keep asking myself, why are we here? We had some of our brilliant minds over 100 years ago telling us this is not the way of the future. And yet we're sort of mired in this pharmacology. Now we can go back, Albert Einstein, I believe he died in around 55, said here, energy, everything is energy, and that's all there is to it. Match the frequency of the reality you want, and you cannot help but get that reality. And I want you to remember that sentence as we go along, matching the frequency with the reality you want. It can be no other way. This is not philosophy, this is physics. And that was from Albert Einstein. And you might think if it was coming from someone else, you might write this off, but it's hard to write that off coming from a great mind like this. So what is the problem? And where are we with trying to solve this problem? Well, the problem really is about chronic disease in this country. And if we think of modern Western medicine and acute disease, it's actually pretty good, particularly related to trauma. But chronic disease is another issue. And upwards around 85% of visits to clinics and hospitals are for chronic disease. I had a surgery professor a long time ago. It really struck me. He said, chronic disease is chronic because we don't know how to deal with it. There was a lot of truth in that statement. And if we look at some of the trends, now they track obesity as a marker for chronic disease, and it does trend very well with this. And if you look in here, 1985, probably 2/3 of the states had no data because there was very little obesity. And if we jump forward to 2010, there's really no state under 20% obesity, and many are over 30%. Now, obesity tracks very well with the chronic disease we said, and with diabetes. And diabetes, certainly aside from the cost, which is enormous, really detracts from people's lives, from their the workforce, life expectancy, and much of this is preventable. Now, if you look at the cost of treating these chronic disease, we'll say in diabetes and obesity, in 2035, it's going to equal what we pay for the entire healthcare system now. And there's a lot of statistics out there. Some will say by 2050, just from treating this chronic disease, we will be bankrupt. And much of this is quite preventable. And there are actually better ways, I feel, to treat some of this chronic disease than what we're doing. Now, I tell people you have to remember this principle, the iceberg principle. Almost all disease processes have a really long incubation period. So by the time we see disease creep above the surface, where there's a lot of fatigue, low energy, pain, discomfort, sleeplessness, etc., we know this has been going on a long time. And you see below the surface, what's been going on over years and decades is poor supply of nutrients to cells, poor supply of oxygen, low blood flow, low heart function, etc. And this has been really evident in some studies. If you look back to some of the Korean War studies, Vietnam War studies, and even in accident victims, young accident victims as young as 14 years old, where they did autopsy studies and looking at their coronary arteries, and shocked to find in these young people in their adolescent years, some in their early 20s, could have 30, 40, 50% blockage in their coronary arteries, yet they were not having symptoms of chest pain where you would think they would have a heart attack. They were basically young, healthy individuals who died from traumatic injuries. So we see it starts very early in life. And our goal is to correct these cellular deficiencies as we go through life. We may be young and healthy, but there's always some imbalances going on, and utilizing, we'll see with pulsed electromagnetic frequencies, this therapy can correct these as we go very safely and efficiently. Now, let's look at life expectancy for a moment. Well, most charts will say in the US, men live an average of 76 years and women 81 years. And it varies just very little from that right now. Now, let's go back a bit. This is a French physician, Alexis Carrel. So he won a Nobel Prize in physiology in 1912. And this was common thinking during his life. The cell is immortal, he said. It's merely the fluid in which it floats that degenerates. Renew the fluid at regular intervals. Give the cells what they require for nutrition. And as far as we know, the pulsational life can go on forever. That was common thinking, not unusual. Well, let's fast forward to Leonard Hayflick in the 60s, who wanted to test this in the lab with cell cultures under rather ideal conditions, and see that as these cells divide, they would lose a little bit of their vitality, and somewhere between 52 and 60 divisions throughout life, these cells would undergo. And he called this the Hayflick limit. Okay, now, so he proved in a lab the cells are not immortal, as was previously thought. The cells have a finite limit to replication or cell divisions. And if we give our cells ideal conditions, maybe those conditions that Dr. Carrel stated, that replenishing the fluid and giving the cells the nutrition they need, Leonard Hayflick showed that these cells could go on about 120 years, give or take a little. So that has been felt to be the limit of human life. Now we fall far short of that. I mean, occasionally you read of individuals who are approaching that. I remember recently reading, I think the oldest known person, a woman on the planet now, is a woman in Italy, 117 years old. So very close to this limit of human life. So what is a solution? And I don't want to say what is the only solution, but what is a solution? And we're going to talk about BEMER and pulsed electromagnetic frequency. Now, BEMER, all it takes right here, simple, 8 minutes twice a day, lying on a mat. And this is a common statement. How could something so simple provide those benefits? And here we can go back to see where's our thinking, where's the mindset, where is our brain tuned into now? It's really tuned into pills and drugs. We think we got to take something, and yet here's something very simple, easy to do, does not have all the side effects of pills. I tell people prescription medications taken as prescribed is the fourth leading cause of death in this country. I mean, that's astounding. And here we have something that can do a lot of good very simply without the bad effects. So what can it do? What are some of the benefits we're going to see? Well, remember the iceberg principle and everything going on below the surface before disease rears its ugly head above the surface. We see this loss of blood flow and nutrition and oxygen. So the BEMER is going to correct these deficiencies. And there's a lot of great science behind this. And I was recently, I was displaying, doing some demos on the BEMER, and had a gentleman came in, sort of running roughshod over everyone there, and particularly me. And he just said, "This can't do that." And I wanted to talk to him, but I couldn't get a word in edgewise. And he reminded me he was a physician and an MD, and he can look this up, which I certainly encourage him to. And he basically felt this was quackery. And how could anyone be recommending this to patients? Now, here's someone, I sort of looked him up at what he did, but here's someone who's handing out a lot of medications to people. And here's someone steeped in science long, long before pharmaceuticals were around. So I just sort of wrote that incident off as someone who really did not do the due diligence to look at this. And unfortunately, his patients are not being afforded some of the best care on the planet now. Now, anytime I present the BEMER, I need to go through some of the disclaimers that, and this is all sort of generic FDA jargon here. It's not intended to diagnose, treat, cure, prevent any disease, and you should certainly consult with a licensed healthcare provider before starting any protocol. We certainly work with our patients who utilize this, help them out so they get established in how to use the BEMER, what's most effective for them. Now, you could go onto pubmed.gov and punch in BEMER vascular therapy, and you could look up some medical and scientific research there. There has been publications on this. It's been a very well-established approach. It's an FDA-registered Class 1 device, but the paperwork for a Class 2 in America is pending. They have 5 international patents. They're used worldwide in hospitals and clinics in Europe. It's utilized frequently in hospitals and actually is a billable treatment device. Now, the BEMER, it was developed in 1998 by a physicist, Dr. Kafka. And he was building the early prototypes in his garage, and he needed some people help with distribution and marketing. And this family, the Gleim family, they were in Liechtenstein between Switzerland and Germany, and a rather well-known family over there in the marketing world. And the senior Gleim did not want to enter into this with Dr. Kafka, But he persisted and finally said, well, let me give it a shot. And after the first year, they sold over 3,000 units of the original model of BEMER. And from then on, the Glein family has taken this under their wing from the marketing distribution standpoint. Dr. Kafka is still alive and still does some work on the scientific end. Now, trying to get into the heart of what BEMER does, we really need to look at our vascular system. And here you see from our good friend again, Sir William Osler, longevity is a vascular question. Now, I can go back further than that. You see down there, Thomas Sydenham was an English physician, considered the English Hippocrates. This was back in the 1600s. And he said a man is as old as his arteries. So, 400 years ago, we knew of this. And today we know 50% of age-related mortality and disability is a result of vascular diseases. And this is really where BEMER has its great effect. So if you think of the 100 trillion cells in our body, they're all nourished and cleansed via the capillaries or the microcirculation. Now, the microcirculation takes up about almost 75% of our vascular system. And that's enough to go around the world a couple times. And that's where the work is done. Oxygen's exchanged into the tissues. Waste, you can see carbon dioxide waste come out. And this is where we have the biggest effect on the BEMER. Now, just to give a little more science on microcirculation and longevity, there was a study, this was done in Italy, and there's a region there where people have a longer than average lifespan, and they wanted to try to find out why. And so what they did, they looked at some biomarkers in the blood. It was some really pretty cool work they were doing. I wish those biomarkers were something that we could easily get now, but this was on a research study. So they looked at biomarkers that told them how young, how efficient is the microcirculation in these people. And what they found that the perfusion or blood flow through the organs and muscles of these people was as efficient as that in individuals who are 30 years younger. So there are some people looking at this and say, well, maybe we can look at people who've been using BEMER therapy for a while and see what the physiologic age of their microcirculation is, because this is where BEMER has its big effect in the microcirculation. And you see right here, from the arterial side on the left of the screen, oxygenated red blood cells come in, deliver oxygen, deliver nutrients. And on the venous side on the right, carbon dioxide and waste come out. So we need this inflow and outflow to be very efficient so that we can stay younger than our years. So BEMER effects. Well, we'll look at this, but 28% improved vasomotion, and we saw in the video the effect of vasomotion in that flow. This allows for more capillary vessels perfused, so that microcirculation, some vessels that are just blocked and there's no blood flow, are opened up. We get improved venous drainage, which is removal of waste, and almost a 30% increase in oxygenation of tissues. And I always tell patients, I said, if I had a drug that would even come close to this, I would have people lined up from, Dallas to Albuquerque begging for this medication. And yet you have something here that is safe and incredibly effective and backed by great science. Now, when we talk about the increase in energy with the BEMER, this is a hard number to comprehend, but there's 21 sextillion chemical reactions per second in our body. Every one of those needs energy. And when we look at life and death, we can really, on a simple level, say, when we are good at making energy in our cells, and when we're 5, we really do that well, we have life, a lot of life. And when we become deficient in making energy, we lose that life. And when we hit that tipping point, then life is no longer sustained. So energy production is crucial, and BEMER really benefits us with more energy. Now, the vasomotion we mentioned is really, as I said, the motion of the vascular walls in this microcirculation, and they call that cardiac assist. Now, if we look at a young, healthy person, there's about 30 to 50 of this vasomotion, sort of contraction, relaxation, 30 to 50 times every 10 minutes. Now, if we take someone elderly or diseased, that could go as low as 1 time every 10 minutes. Now, if you think the heart has to pump blood through all our vessels, and if these vessels are not moving and the flow is sluggish in this microcirculation, these 74,000 miles, it puts a big strain on the heart. So this vasomotion we've been talking about is called cardiac assistance, or I'm going to help out the heart and take the strain off the heart. So a BEMER therapy, 1 session, 8 minutes on the mat, can really benefit the heart. Now, the BEMER signal, this is a patented signal. Now we get into a little of the physics, and I want to just present some of this to you so you at least have a basic understanding of this. The BEMER signal is a sine wave, and you see on the left, there's a lot of different signals, electromagnetic signals that are generated, sinusoidal, trapezoid triangles, there's double sawtooth, triple sawtooth. The BEMER signal is a sinusoidal wave, and within each cycle of the sine wave, there's 40 stimulations. And that was important for Dr. Kafka because he wanted to make sure the signal was safe. And we're going to look at what these 40 stimulations do to help make this safe. Now, just for any physicists out there, here is the physicist equation of the BEMER signal that was developed by Dr. Kafka. Just so you know, there actually is a real equation here. It doesn't mean a whole lot to me, but this is the actual equation he developed. Now, here you see a depiction of someone on a BEMER mat, and they're lying there, and they get this patented signal. It's with the sinusoidal signal with 40 stimulations in each cycle. That stays the same. The song remains the same. Now, the intensity is the volume, and that can be changed. And if you see on the right, the intensity is measured in microtesla, and it's simply on the BEMER mat here, 3.5 to 35 microtesla. And it functions at a frequency or hertz of 10 hertz and 30 hertz. Now, these are really specific, and they have a lot of meaning. They're not just arbitrary frequencies that were obtained. Now, if I look at the history of pulsed electromagnetic frequency, which BEMER is spawned out of, you see here, way back 200 BC, this Dr. Galen here, Greek physician, was exploring the cleansing power of magnets and magnetism. And then as we move forward, Paracelsus was a very famous physician who was using magnets to treat disease. Well, the magnets he was using was lodestones, and these were very weak intensity, but people knew, hey, there's some effect here. Then in the 1700s, carbon steel magnets were discovered, and they could get higher intensities with these. And then along came this Italian physicist who harnessed electricity. Now, electricity was always here in the atmosphere, but being able to harness this and to get a steady electric current to use with the magnets really changed things. And Nikola Tesla in the early 1900s used these electromagnetic fields for health purposes. So you think that's over 100 years ago was using this for health purposes. Well, around that time, there was a very famous report called the Flexner Report, Flexner. You could look that up on the internet. Anyhow, this brought about the rise and power of political medicine and a shift to nearly 100% dependence on pharmaceuticals. Well, this led to a bit of dormancy in electromagnetic therapy until the mid-1970s. And it was in the mid-70s that someone was using electromagnetic field therapy for racehorses. And that increased their endurance and speed, seemingly a good thing. Then in 79, the FDA allowed electromagnetic fields to be used for non-union fractures, so people who had fractures that wouldn't heal, and it's very effective. To this day, extremely effective for bones. In the late 1980s, the FDA allowed what was in pulsed electromagnetic fields for pain and swelling in soft tissue. And now, through a lot of research over these years, pulsed electromagnetic field therapy is accepted for many things, reducing pain and inflammation, the effects of stress in the body, and platelet adhesions, which can lead to clots, improving energy circulation, oxygenation, sleep quality, blood pressure, cholesterol levels, the uptake of nutrients, removal of waste, and the ability to regenerate cells, improving the immune system, stimulating RNA and DNA. And this somewhat goes back to the Hayflick limit, Leonard Hayflick, and about the cell divisions and the length of human life, that we can actually balance this RNA and DNA and possibly help us to come closer to not just the 120 years, but to be healthy for our years. It accelerates repair of bone and soft tissue and can relax muscles. So that's a huge effect that we can receive every day very safely. Now, when we talk about safety, and Dr. Kafka was interested in that, there's a few things just to mention here. The Schumann resonance, which is generated by lightning discharges from the surface of the Earth up into the ionosphere, about, 1,000 kilometers up or so. This is really essential for the life and health of our bodies, and NASA knows that when astronauts remove themselves from the magnetic field of the Earth and the Schumann resonance, they age quickly. Now, the Schumann resonance has a very weak signal that you can see measured in microtesla, very weak, but functions around 3 to 60 hertz. Now, the second thing is the magnetic field of the Earth. That has a little more intensity. It's 33 to 66 microtesla. Now, these are important because we said the frequencies of BEMERs used in 10 and 30 hertz are certainly within the frequencies of the Schumann resonance, and the intensity, or the microtesla, was 3.5 to 35, and that's within the magnetic field of the Earth. So he felt this would be safe, and in order to get the intensity he needed, that's where the 40 stimulations within each sine wave came in. It was very important. So here we are back to the BEMER signal. The signal is the same. And that signal, the patented BEMER signal, is the same as it was in 1998 in the first generation as it is now in the third generation BEMER. Now, there have been some improvements from the first to the second to the third. A little bit more stimulus based on frequency variation, because initially there were not 10 and 30 hertz. There was just a signal hertz of, it was 10 hertz, and they then introduced a 33 hertz, and then they changed that 33 to 30 hertz. So there was some testing research done with the frequency variation, and then they developed this rhythm giver signal, which improved the signal and given a prolonged effect. And that signal essentially is every 20 seconds, the intensity rises to an intensity of 10. Intensities can be programmed in from 1 to 10. So every 20 seconds, even if you programmed in a selected intensity of, say, 4, it would jump to 10 every 20 seconds for about 5 seconds and then come back down. This seemed to increase the length of the benefit. And if I go back and you see on the left there, the first generation, it lasts about an hour. Because, you know, it's like you think taking a medication, you're going to take it, it has this peak effect, and then it comes down. And then you have to redose again. Well, here, you'd get the peak effect about an hour, and then may have to use it again. And then the second generation went up to 4. And now in the third generation in 2010, it's around 12 hours and maybe up to 18 hours. But this is where the 8 minutes twice a day comes from, that you can maintain these maximal benefits over a 24-hour time frame. Rather easy to do. Now, a lot of the research, as I said, was done at the Microvascular Institute in Berlin. Dr. Rainier Klopp, who's still living and doing research, not just on BEMER, but a lot with electromagnetic therapy. And he has stated unequivocally it's the most effective and widely researched physical therapy method available today. Now, how about its effects on the liver? And you can see they looked at this at Dr. Klopp at their institute. And what they showed, you can clearly increase the blood flow in the sinusoids or canals of the liver circulation. You can get an improvement or reduction of fatty liver conditions. And that's a very common condition nowadays. I always tell patients they're surprised. The most common reason we see fatty liver now is all the fructose. People are eating too much sugar and fructose. People think it's alcohol, but not anymore. It's all this fructose that's in everything. And you get a clear increase in the concentration of reduced glutathione in liver cells. And this is sort of the mother of all antioxidants. So huge benefit, 20 days of therapy. And I'm going to just show you this. This was the effects on the liver from BEMER therapy. And they're going to show observation of a patient with alcoholic-related fatty liver, initial status, and then this patient went under 2 weeks of BEMER therapy, just 2 weeks, and they're going to show the status after that. Now, what you're looking at is flow through the liver sinusoids, and you can see it's sort of like a wash machine. There's flow both ways because it has a unique circulation where there's arterial and venous blood mix. So you're seeing flow going both ways, and you see here very sluggish through here. So with very poor flow, we're going to expect poor nutrition of the liver cells, poor oxygenation, decreased energy production, poor removal of waste. So the cells are not going to be very healthy. And we know the heart is going to have to work harder. So then the patient did a couple weeks of therapy, and they're going to show here in a second what it was like after just those 2 weeks. So here you can see much more improved flow. There's, well, you know, it's hard to see the vasomotion, but that increase in flow is due to the vasomotion in there. And so we get a reduction or elimination of the fatty liver, and we get increased production of the glutathione, a major antioxidant in the body. And this is just from 2 weeks of therapy on a BEMER. Now, at Dr. Klopp's Institute, this was an article they published just a few years ago, 2013. And he wanted to look at various devices, and you see over on the right are listing of the devices. The control was a BEMER, the BEMER Classic. And then you could look on the internet and see some of these others on the right here, the magnet or the impulsor, IMRS, they're out there. And what he did, you can see on the left was day 0. started out and he was looking at changes in the tissue oxygenation. And he was only doing one treatment a day with each device. And on day one, you can see the BEMER already had about 16% increase in tissue oxygenation. None of the others came over 5%. Now, his premise was from exercise. If you just said, I'm going to go exercise, maybe I'll go walk through the neighborhood for a couple miles, you can increase your tissue oxygenation 7 to 8%. So he said, I need to be better than 7 to 8% because I can just go out for a walk and get that. So already he was at 15, 16%. Day two, second day, he's up over 25%. Everything else was around 10, 11 was the best. And then on day three, he approached 30%. All right, then he decided on the fourth day, there would be no treatment. And he just wanted to see what the fall off would be, because obviously it's like taking a medication. All right, I'm stopping the medication. What will be the fall off? And he found on day four, without the BEMER therapy, he was still, around 12, 13%, much better than with exercise. And most of the others were down to 1 or 2% or 0. And that led him to say it was the most efficient electromagnetic device available. Now, some more research. BEMER is in cooperation with NASA. This was signed in 2015. They signed a contract. NASA wanted to use the signal, but as we've stated before, Dr. Kafka had patented this signal, so you just can't use this. So they're in cooperation with BEMER, working with them to use this because, as we mentioned with the Schumann resonance and the Earth's magnetic field, these are very vital to our health. And when astronauts leave this, they can age quickly, and particularly losing muscle and bone mass. And we know from the research, BEMER is very effective at increasing muscle and bone mass. So that's what they want to use it for. And so they're working with them. Now, NASA has done their own study on pulsed electromagnetic frequency. It was a 4-year collaborative study on how efficient are these electromagnetic fields to stimulate growth and repair of tissues. All right, you could look this up, the NASA study, Thomas J. Goodwin. Well, what they discovered that the benefits of low frequency, low intensity, rapidly varying PEMF. Right? Now, this fits right into the wheelhouse of BEMER. We said the frequencies, 10 and 30 hertz, certainly staying in those frequencies of the Schumann resonance. The intensity was low, not exceeding that of the Earth's magnetic field. And through some of their advancements over the years, this rapidly varying or pulsing of the frequency. So NASA found there's better healing and regeneration of damaged or diseased tissue. There's greater cell longevity. So we may be getting, say, we want to approach more of that instead of the standard life expectancy, the Hayflick limit, and not just to live longer, I tell people, but to live healthy, give more life to our years. There's an upregulation of genes related to collagen, so critical to our health production. Improved cellular voltage, and voltage is critical to have the appropriate, we're sort of electrical beings, and we need an appropriate cellular voltage to maintain health. And then cell restoration and growth. So basically, NASA said low intensity, low frequency, similar to Schumann, rapid rise and fall is the most effective PEMF energy for healing and regeneration. And that is why NASA signed on with BEMER. Now, I'm not saying any other PEMF device is necessarily bad. I don't have great experience with them. I have some patients who have utilized BEMER and some of these other devices. But BEMER, I feel, when I did my due diligence, had the greatest science behind it that I could find. And once I got it and used it on myself, I realized those great benefits. And here you can see some of the benefits for you. And all these things are about, I feel, slowing the aging process. I mean, there's an aging process. We know even if we hit the Hayflick limit of 120 years, there's a process of it. But we would like that to be slow. And what we see in current day society is this rapid acceleration of aging. Now, here's another video I wanted to show you on microcirculation and immunity. So I said these videos were critical to my decision to jump into the electromagnetic frequency world in BEMER. And this video is the first generation, the BEMER 3000. So you can see there was a 15% increase in the microcirculation and oxygenation. That's been improved with further advancements in this science. And here you can see on the top, they're opening up of some of the microvasculature, greater delivery of oxygen, greater production of energy, and better removal of waste. And here we're seeing some of these very thread-like vessels that are not even open and very poor flow and putting a big strain on the heart. Again, with utilizing this first generation BEMER, there's an improvement opening up this microvasculature. And looking at this with some of the other videos from the third generation BEMER, that effect is even greater. And then we'll see one on immunity, an increase in white blood cell adhesions, an increase in various white blood cell molecules. So it's excellent. You can see these clear vesicles lining up. That's after just 2 minutes. And I sometimes I will get from patients that, well, I don't have 8 minutes twice a day. It's hard to imagine, but people do say that. I say, well, if you can do it 8 minutes once a day, from the research we see, you'll get a benefit. And even if you can just do 2 minutes once a day, you're going to get a benefit. If you can't do 2 minutes once a day, it's probably not the device for you. So we know we can't necessarily get younger. We can't be Benjamin Button and go backwards, but we can certainly feel younger and be physiologically younger than our years. Okay, that's a lot of some of the science and background of the BEMER. I want to just show you what it is. Here's a BEMER Classic model that comes with the B box. The B body is the mat that you've seen in some of the pictures, people laying on. Has some accessory device here, a B spot. This is around 4,200 in tax. And this is more of a push button. You would buttons that are recessed and pop out and you push them. Whereas the BEMER Pro set, again, that's a little more expensive. It's more of a touch screen. It has, again, the B body. It has that B spot, but it has some other accessory devices, the pad and the light. And it has a little more functionality on the B box. And I would say, in my experience, that we probably 90% or more people will get the professional set, this BEMER Pro. But I've had a few people, they live alone. They said the classic set is all they need. And I want you to understand the signal in the BEMER Classic and the Pro set is identical. That signal, as I said, the song remains the same. It's just some of the, we'll say, bells and whistles are a little different. Now, there's a warranty. It's a 3-year warranty. There's lifetime system updates, and there's usually a lot of help for people, and help for people that we work with on the BEMER. They can, call us or email us, and we do put out a BEMER Life newsletter every month talking about different aspects of the BEMER, people who use it, and some different ways people can use it, and relating some more of the science behind this. Now, these are just some pictures showing this. Here's a gentleman, he just puts it on the couch and he's laying down on the mat. I had my mat on the floor for the first year I had it, and now I have it on the bed. It's underneath the mattress pad, secure in there, and I use it on the bed. It makes it easy. In the office here, we have a massage table. We have it on, and people can come in and use it here. Here's some of the localized applications. On the left, you see the pad. It's wonderful for various joints. I've used it a lot for knees. Shoulders are great. Back, neck. And on the right is a B sit. Now, that does not come with any set. It does not come with the Pro set or the Classic set. you buy it separately. I actually have that in the office, and you can see the young woman here sitting on that. And it's excellent for the pelvis area, low back. You can even put it up on tilted upright on the back of the chair and treat most of the back that way. So if you have a job or you're at home sitting at a desk working, it's actually wonderful to use. People also use that traveling, truck drivers or people on long airplane rides. You can take it because the box you can take on the plane with you. I've done that, and you can get a battery pack for the box, so you don't really need to plug it in. Here's a B spot, again, for more targeted application of a particular joint, knee, elbow, etc. And with the Pro Set, it does come with laser light therapy. And this can be beneficial for various things, particularly skin irritations. I think of eczema, psoriasis, various rashes, scars, wounds, helping them to heal. Some people I don't have experience with it use it for more, say, facial rejuvenation or various wrinkles or spots and whatnot. So that comes with the Pro Set, but not with the Classic. Now, BEMER in these new models has a patented sleep program that is beneficial for sleep quality. A lot of people who have sleep issues, it's good for regenerating, detoxifying the organs at night. And the sleep program, there's not any manipulation you can do it. You can't change frequencies or times or anything. It's preset. And basically it functions for 2 hours where you're going to sleep. And then it comes on 2 hours before you wake up. If you program it in, you can say, I'm going to get up at 6 in the morning. It'll come on at 4 and give you very gentle treatment. It's very low intensity treatment. Now, pets love the BEMER. I grew up with dogs all the time, but do not have a pet now. But I've been to some of the BEMER conferences, and it seems people get the BEMER more for their pets than themselves. So particularly dogs and cats. It's also used with horses. And here's a woman, Linda Tellington Jones, who's sort of well known in the animal world. She actually has been working with BEMER since 1998 at its inception. She does a lot of conferences and seminars about pet therapy she does, along with use of the BEMER. And if we look just here, was just after a few minutes using BEMER therapy on a horse. They have a pad draped over the neck. And you can see the skin surface temperature curve just increasing, the increase in flow here. And that increase in flow is a great benefit, as we said, with oxygenation, removal of waste, etc. After just a few minutes of therapy. BEMER actually has a new BEMER vet model, a veterinarian model, just came out this year. I don't really work with animals, but they actually, the amount of units they appropriated to this country have sold out already. So it's been, BEMER's used a lot with pets and animals. Now, lest you think BEMER is only for an older baby boomer like myself, BEMER's used in sports, particularly in Europe, where obviously BEMER was created. A lot of the soccer clubs there, AC Milan, Schalke here, and you can see BEMER sponsors a lot of these events. And these are young athletes. And you can think, if you are utilizing BEMER and you get an increase in oxygenation, it's almost like blood doping, but it's legal and safe and very effective. So it's used by a lot of athletes. Here's USC men's tennis team has used it. You can see they say we lie on the mat and we feel refreshed. And we always ask, but you come into our office anytime and try it out and see how you feel. And you can see with these athletes, young athletes feel this way. Here's triathletes. You know, a lot of the research with athletes come out of Switzerland. The Olympic teams in Switzerland have used this. A lot of the athletes that were at the Rio Games last year from Europe had BEMER mats with them. And so they get an increase in oxygenation. So doing these endurance events, it's very beneficial. And they get faster healing or regeneration of tissue after these events, where there's actually a lot of trauma, lactic acid produced, and they have a quicker recovery and can get back to their events sooner. I remember Mark Girardelli when I lived in Europe, and he's probably the greatest alpine skier of all time. Certainly, you could argue that. And he's one of their sports ambassadors now. And of course, during his career, you imagine a professional skier, downhill racer, a lot of injuries, a lot of trauma to joints, and he says it really saved him. When he retired from the sport, then he got into BEMER to help him recover, as did another great spokesman for them is Boris Becker, and he was a big user of the BEMER. A lot of it, and I will mention one other sports. There was the first professional sporting event sponsored by BEMER in this country was it's called the Race Across America. It's a bicycle race. They have teams, 4 or 8-man teams. They go from San Diego to Annapolis, and it's not like the Tour de France. It's much more difficult. There's no stopping. There's no do your ride and then sleep in a fancy hotel. You get in the back of a van and you wait till it's your turn again, and it's just continuous. Well, BEMER sponsored a 4-man team, and this 4-man team set a new record. I think it was 5 days and 13 hours or something. And they actually beat the 8-man team. And these young athletes who, they just wanted to sponsor, but they said to a person, it really helped them to recover. So you can think if you're riding, 200-300 miles in all sorts of conditions, uphill, high altitude, and then you got to just try to get some rest in the back of a van. It really helped them to recover their muscles so they could get back on the bike again. We had, you'll see here, Rudolf Schenker. Some of you people my age may remember the Scorpions, but he's actually from Germany, and had read something about him, and he's a big BEMER user. He's, I believe, around 68 now, and with this band, they still tour all over the world, and he takes his BEMER map with him. And we did a little article on one of our BEMER Lives with him, and had a picture of him, and I said he's 68, but he looks great. And so he said it really helped him with traveling, being on stage all the time with some back injuries and whatnot. So a lot of endorsements from various sectors of society here. And it's very interesting. We spend the first half of our lives compromising our health to gain wealth, and the second half of our lives spending our wealth to regain our health. And, when I first looked at the BEMER, I said, this thing is, if I had to say who is the perfect individual, well, when I think of things in prevention, I said it's a young, really healthy person that's correcting all of these cellular deficiencies, correcting them as they go through the years. Now, most of the time people enter into this because they have a problem. They got arthritis and pain, great with pain. They may have, we think of some aging eye disorders, glaucoma, cataracts, macular degeneration. There's really great information from people who work with individuals with these eye disorders. We see it with cardiovascular health, really assists the heart and takes some of the burden off the heart. You think of the work your heart's doing, it never rests your entire life. So if any help you can get, it really will give life to your years. Think of things like kidney function is wonderful for back pain. It is really beneficial. So it has a wide range of effects. And is very simple, easy to use. Here at our clinic here in Albuquerque, we rent them out for people who do, well, let me try it out. And, I've had various experiences with individuals, and had people who've got on it for 8 minutes here and had such a profound effect, they wanted to get device right then. And other people, it may be a while. And I can use myself as an example. After I did my research, I said, I definitely want one of these. And I had some very specific things. I've had a testimonial we can send to you on it. And, you know, it was not immediate, but after about 3 months, I was really blown away. And I said, if someone just stole this now, I got every cent worth out of this. And I've been using it, you know, every day for the last couple of years, and even have taken this on trips. So, but sometimes people want to try it out first. And so we do offer a rental in our clinic. As long as we're here, anyone can come in at any time and use it for free to just see what they want. So this is us, Expanding Choices. It's our address there, phone. I mean, if you had any questions at all, you can call us, you can email us. We'd be happy to send you a packet of information, try to answer any questions. I really hope you look into electromagnetic therapy, do your due diligence, and I think you'll come to a very similar conclusion to what I did, that this is some therapy that can really benefit all of us, bring life to our years, benefit us in the aging process to really slow it down. So you can look for us on future webinars. We do webinars. You can see up on the right there, Keto MD. We do a lot with low carbohydrate, high fat, ketogenic diets, and have webinars on that, as well as on cardiovascular health, preventing heart attacks and strokes. So let us know if you have any questions. I really appreciate you taking the time to listen to this. I urge you to really look into BEMER and give us a call. We'd be happy to work with you on this. Thank you so much, and you all have a good night.